Guys, today's topic is glycogen synthesis, and we will discuss one disease also, that is Anderson's disease. Okay, so guys, glycogen synthesis. So glycogen synthesis occurs in the fat state, right? This occurs in the fat state, and in the fat state, when the levels of insulin is very high, we are able to generate the, synthesize the glycogen, right? Where is the site? What is the site? Site is liver cytoplasm, right? So liver cytoplasm, both for glycogenolysis and for the glycogen synthesis. The site is liver cytoplasm. Okay. Now, guys, to synthesize the glycogen, right? First of all, we should know about the glycogen. Guys, glycogen is a polymer or the polysaccharide, you can say. So polymer of the glucose, right? So this is a polysaccharide, and the definition of polysaccharide is anything which is 10 or more than 10 sugar residues are utilized, right? So polymer of the glucose with alpha 1,4, we all know alpha 1,4 glycosidic bonds in the linear chain, right? So that is in the linear chain. So alpha 1,4 glycosidic bonds will be present in the linear chain, right? So that means if I have to draw the structure, it will be like, suppose this is the glucose, just, I'm not taking the actual structure. To understand, we can just make these circles, which is one glucose. Suppose this is the glycogen which is being made, and this bond is called as alpha 1,4. So this bond, every bond is alpha 1,4 actually, right? But there is a bond at the branch point. This is called as alpha 1,6. So suppose this is also glucose, this is glucose, all are glucose actually. So alpha 1,6 glycosidic bond. Okay, alpha 1,6, and that will be glycosidic bond. It is fine. So guys, this will be like at the branch point. We can write alpha 1,6 bond at the branches. So as we know, this is the only bond which is, alpha 1,6. Rest will be alpha 1,4 again, right? Obviously, like, that is very clear because the number of carbons are limited, and, we are using both 1,6 and 1,4 here. So this will be again 1,4. Okay. So that's how the glycogen is being, structured, is made like this, right? Now, the next point is simply like, why should we store glycogen? Why can't I just store the glucose? Why we have to make such a complex structure which is very much branched? Okay, first of all, guys, glycogen is highly branched. Okay, so glycogen is highly branched. Now, when I say highly branched, I'm comparing it with the starch, because glycogen is also called as animal starch. It is similar to the starch, but more branched compared to the starch and present in our liver and muscles. So highly branched, okay, with the branching at the every 10 to 13 glucose. So guys, after every 10 to 13 glucose, and now if I have to say about starch, okay, starch has two types of starch. One is called as amylose. Amylose is a linear thread, right? So amylose is a linear thread, but amylopectin has branching. So amylopectin, if I just compare it with just a starch, like, just a revision, quick revision, starch is having two types of starch we have. One is called as amylose. Guys, amylose is only having alpha 1,4 bond, and it is unbranched, right? So that is linear. And guys, because of this, it cannot be digested easily, and that's why it have a low glycemic index. Okay. So glycemic index of the amylose is very low. Like amylose is present in, for example, sweet potatoes. Here are some other fibers. So sweet potatoes are absorbed slowly compared to the potatoes, because potato contain amylopectin. So guys, amylopectin is also the starch. It is branched, so both alpha 1,4 and alpha 1,6 bonds are present, branched at every how much glucose residues? Like almost 25 to 30 glucose. So it is less branched compared to the glycogen. So that was just for the comparison purpose. Okay. And guys, starch, which is amylopectin, has a high glycemic index. You know what is a glycemic index? Like, how fast a sugar is being absorbed. जैसे bread होता है, white bread, उसका glycemic index बहुत high होता है. It is almost 90. Right? जो हमारा ग्लूकोज है, जैसे मैंने ग्लूकोज पी लिया प्योर, तो उसका तो 100 है ही. That is glycemic index. But white bread has a high. Then some fruits have a higher glycemic index, like grapes, for example. Okay. So glycemic index is a measure of how fast blood sugar is being raised by a particular food. Okay. So, okay, we are just talking about glycogen right now, and it is branched at every 10 to 13, so it's highly branched. So why the branching is so important in the glycogen? Guys, because one important point to remember is that okay, branching makes the glycogen water soluble. Okay, it will make the glycogen water soluble. Hope you're writing, guys. You must write if you want to add something to your previous notes or to your class notes or whatever it is. Okay, so keep writing. Guys, always remember, when you write yourself, you retain much better. Okay, because if you because every information nowadays is available everywhere, starting from Google, YouTube, right, everywhere. But when I'm teaching you, you're listening to me, and definitely you're giving me your time, very important time. So you must take advantage of that, and you must write anything that is not already known to you, or that is something that is already not in your notes. So keep writing. That is the best habit which will help you throughout your mbbs, right? Because in the end, when we have a lot of course, our notes that we have made ourselves and we have revised it, that will help. Okay. Or you can add the points in your books or somewhere else also, like if you're following some book, that can also be good for you. So guys, branching makes the glycogen water soluble. That's why the branching is so important, and that's why in some disorders like Anderson's disease, where the branching will be less, the glycogen will be linear and will create some problems. We'll see that. Okay. So guys, what I was talking about, that why the glycogen is stored, why can't we store the glucose directly? So guys, we can't store the glucose directly because glucose is osmotically active. Okay. So if I want to store the glucose, I need large quantities of water. And liver is very small organ. So, and glycogen is inactive. So glycogen is osmotically inactive, right? It is inactive. Okay. So that is why we store glycogen. Hmm. So what is the site of glycogen storage? So if we talk about glycogen storage, the two major sites are, number one is liver. Guys, liver is a very small organ of just 1.5 kilograms. है ना? तो हमारा liver सिर्फ 1.5 kg का है. And in the liver, हमारे पास जो glycogen storage होता है, that is hardly 100 grams. Okay, 100 ग्राम ग्लाइकोजन होता है, बट गाइस ये 100 ग्राम ग्लाइकोजन बहुत सारा होता है. This can maintain our blood sugar for how much time? I told you, for 12 hours. For the first 12 hours, our blood sugar is maintained only by the liver glycogen. And I told you already that muscle glycogen doesn't participate in maintenance of the blood sugar in the fasting state. Okay, right? So liver सबसे important organ है हमारा, है ना? तो we should care about it, right? We should care for it. तो यहाँ पे ब्लड शुगर मेंटेनेंस दो ही पाथवे से होती है, मैंने आपको बताया. One is a glycogen, other is gluconeogenesis, and both take place in the liver only. So दोनों ही liver में present होता है, right? So 100 gram of glycogen is too much, right, for 12 hours of fasting. Guys, this is like maximum density, I can say. because mass by volume is density ना, right? Okay, है ना, आपने तो बहुत पढ़ा यार अभी recently, है ना, mass by volume, right? Something must have clicked in your mind, some more formulas. Okay, so जो density है वो यहाँ पे high होगा लीवर का. फाइन. दूसरा है हमारे पास मसल्स. मसल्स वैसे बहुत बिग ऑर्गन है. जैसे कोई भी नॉर्मल ह्यूमन बीइंग होता है, हेल्दी, मतलब एवरेज हेल्दी ह्यूमन बीइंग, उसकी बॉडी का अराउंड 40% मसल होता है ना. जैसे इफ आई एम 80 kg, माई बॉडी हैज अराउंड 32 kilograms ऑफ मसल एवरेज. कम भी हो सकता है, थोड़ा बहुत ज्यादा भी हो सकता है, डिपेंडिंग ऑन लाइक पर्सन टू पर्सन. तो मसल्स में हमारे पास करीब होता है 300 grams of glycogen. So guys, obviously quantity is high, so I can write maximum quantities. Okay, maximum quantity. So guys, ये दो organ है which are the most important organs which store the glycogen. थोड़ा बहुत किडनी में भी होता है. ऐसे तो थोड़ा बहुत you can find in some brain cells also, but it is almost insignificant. Kidney has little bit significant value that I can say, but these are the two major organs, so we will stick to them. Glycogen storage. Okay, now moving further, let's talk about the glycogen synthesis process. Okay, so guys, for the purpose of glycogen synthesis, first of all, it is a fat state. So I am in fat state, let's say. So in the fat state, I consume glucose or carbohydrates. Right? Guys, this glucose will enter the liver cell via which glucose transporter? Can you answer? Name the glucose transporter. So that is GLUT2, right? Liver contains GLUT2 that we have discussed. So guys, liver cell के पास पहुंच गया glucose अब. So now the liver cell has the glucose. अब liver cell के पास enzyme होता है glucokinase. Fine. So what liver cell will do? Liver cell will convert glucose to glucose 6 phosphate. So that's the enzyme that's called as glucokinase. So this is functioning in the liver only. Now guys, glucose 6 phosphate. Okay, glucose 6 phosphate जो होता है, that is, yes, okay, Shagun has replied GLUT2, fine. So glucose 6 phosphate is guys acted upon by the phosphoglucomutase. Guys, this is a very important enzyme. क्यों? Because guys, this is the enzyme. मैं यहीं पे लिख रहा हूँ क्योंकि ये क्वेश्चन मैं फिर से लिखने वाला हूँ in the later chapter. So common enzyme to both glycogenolysis and glycogen synthesis. GGL for glycogenolysis लिखा है मैंने and GS for glycogen synthesis. So what is a common enzyme which is used in both the pathways, that is of glycogen synthesis and glycogen degradation? So guys, this is the answer. Okay. So guys, a mutase है. Mutase means a isomerase type of enzyme. So this will convert the glucose 6 phosphate to the glucose 1 phosphate. Okay. So this will convert the glucose 6 phosphate to the glucose 1 phosphate, basically. Okay, and now guys, on this glucose 1 phosphate, we will just add the UTP, uridine triphosphate, and we'll be getting UDP glucose. Fine, UDP glucose will form. So guys, this UDP glucose is the active glucose donor. Okay, active glucose donor in the process of glycogen synthesis, yeah, glycogenesis. Right, so this is the active glucose donor, UDP glucose. I have just added the UTP, uridine triphosphate, and I got the UDP. So actually the pyrophosphate will be released, this phosphate and one more phosphate from UTP. So guys, that is fine. So basically I just wanted to make UDP glucose. What else I need? So in short, For the glycogen synthesis, what we need for the glycogen synthesis, we need number one. सबसे पहले हमें चाहिए that is called as the UDP glucose, which is the donor of the glucose, जो हमने बना लिया. Second, I want the rate limiting enzyme that's called as glycogen synthase. Okay, so glycogen synthase I'll be taking. And third, I'll be taking the branching enzyme. Fine, branching enzyme I need. And guys, fourth, actually, we can say that is also the first one. I need a primer. Okay, that is called as glycogenin. Okay, glycogenin. So that's a primer. Primer matlab jaise yaar, something which is starting, which can initiate. That is called as a primer. So primer protein hai ye. This is a protein, right? It's not a carbohydrate. So glycogenin. So guys, these four things are required for making the glycogen in the fat state. After my breakfast is over, I need to make the glycogen. So how to make glycogen is a very simple process, guys. Agar mujhe pata hai ki these are the four things that is required, so it's very easy, right? So देखो, first of all, before breakfast अगर मैं बोलूं, ठीक है? So before the breakfast, what is left in my liver? So in my liver, there is residual glycogen is left. क्योंकि 12 घंटे से ऊपर हो गया या 12 घंटे तो हो ही गया ऑलमोस्ट, तो मेरे पास जो भी बचा है वो रेजिडुअल ग्लाइकोजन है, नथिंग मच इज लेफ्ट, राइट? मान लेते हैं जस्ट टू अंडरस्टैंड कि सपोज दिस ग्रीन कलर विल बी glycogenin protein, like this. So next time I'll just make a figure which is green color, so that is glycogenin protein. On this glycogenin protein there is already some glucose. This all the you know circles are just glucose. So minimum at least 8 should be there, 3 to 5 to 7 to 9, it's like 9 here. So glycogen इनके पास already residual glycogen है, ये glycogen है, this black one is glycogen. तो जो ग्लूकोज बचा थोड़ा बहुत बचा हुआ है यहाँ पे, फाइन. अब मैंने कर लिया है ब्रेकफास्ट, अच्छा वाला आलू का पराठा खा लिया है मैंने, आई हैड ए नाइस ब्रेकफास्ट, ठीक है? सो इन द ब्रेकफास्ट आई कंज्यूम्ड अ लॉट ऑफ ग्लूकोज, ठीक है? सो दिस ब्रेकफास्ट गिव्स मी समथिंग कॉल्ड एज, दैट आई ऑलरेडी टोल्ड यू कैसे बना है, यूटीपी ग्लूकोज. तो गाइस इस यूटीपी ग्लूकोज को एक कलर कर देते हैं हम, लेट्स गिव इट ए कलर, लेट्स मेक इट सम कलर लाइक पिंक, फाइन. तो इसको हम एक पिंक कलर दे देते हैं, राइट, लाइक दिस, यूटीपी ग्लूकोज को. तो अब जो एंजाइम आएगा दैट इज कॉल्ड एज द ग्लाइकोजन सिंथेज, इज द नेम ऑफ enzyme. Okay, glycogen synthase is the name of enzyme. Fine. So guys, this is the rate limiting step, first thing. And guys, we can write the regulation here itself directly, that glycogen synthase is activated by definitely insulin. अब देखो इंसुलिन फैट स्टेट तो है ही, इंसुलिन हाई है, तो इंसुलिन क्या करेगा, मसल्स को ग्लाइकोजन बनाने में कैसे हेल्प करेगा? इंसुलिन सबसे पहले GLUT4 एक्सप्रेशन बढ़ाएगा ऑन द मसल सेल्स, बिकॉज स्केलेटल मसल्स के पास होता है GLUT4, है ना? तो इंसुलिन है हमारे पास ऑलरेडी, तो GLUT2 तो इंसुलिन इंडिपेंडेंट है, लीवर के पास ऑलरेडी GLUT2 था तो उसने तो ग्लूकोज ले लिया. मसल को ग्लूकोज लेने के लिए GLUT4 चाहिए, तो वो इंसुलिन अपना काम वहां ऑलरेडी कर चुका है, राइट? इट इज ऑलरेडी हैविंग हाई अमाउंट ऑफ GLUT4, ठीक है? एक्सप्रेशन हो गया. So it is activated by insulin now. Now when it is activated by insulin, uh, oh, and what else? Allosteric क्या होगा? Glucose 6 phosphate. So insulin and the glucose 6 phosphate. These are the two things are that is required. Okay, for the activation of glycogen synthase. So this is allosteric activator, guys. Okay. तो चलो आगे चलते हैं. ग्लाइकोजेनिन ने अब क्या किया? ये ग्लाइकोजेनिन क्या होता है कि चलो मान लो फिर से बना लेते हैं, ग्लाइकोजेनिन हो गया। दिस इज रेजिडुअल ग्लूकोज 1 2 3 4 5 6 7 8 9। फिर से अब हम पिंक कलर ले लेते हैं, 1 2 3 4 5 6 7 8 9। तो अब ये यूटीपी ग्लूकोज से इसने ग्लूकोज ले लिया, ग्लाइकोजन सिंथेस ने, राइट। नाउ गाइस वी नीड ए ब्रांचिंग एंजाइम, फाइन। तो देयर इज एंजाइम दैट्स कॉल्ड एज द ब्रांचिंग एंजाइम। अब हमें एक ब्रांच बनाना है। ग्लाइकोजन सिंथेज अगर कंटिन्यू बनाता ही जाएगा तो सारा ग्लाइकोजन लीनियर हो जाएगा। आई डोंट वांट द लीनियर ग्लाइकोजन, आई वांट ए हाईली ब्रांच्ड, है ना। हमें जो ग्लाइकोजन चाहिए दैट शुड बी लाइक branched, right? Lot of branching must be there. Okay. So branching enzyme का दूसरा नाम क्या है? It is also known as alpha 142 alpha 16 transglucosidase. Okay, transglucosidase भी बोलते हैं इसको, राइट। सो गाइज यहाँ से ये कुछ पोर्शन उठा लेगा, मान लेते हैं कि ये यहाँ से कट करेगा इस एरिया से, है ना, इस एरिया से, सपोज, जस्ट टू अंडरस्टैंड। तो चलो फिर से बना लेते हैं। ये मेरा हो गया ग्लाइकोजेनिन। ओके, दिस ब्लैक कलर इज लाइक प्रीवियस वन, पिंक कलर, राइट, इज लाइक दिस। और मान लेते हैं आप कहीं पे इसने यहाँ पे ऐड कर दिया, सपोज लाइक दिस, 1 2 3 4 5 6, suppose like this. So guys, this is the bond, as we all know, this is the bond which is called as the alpha 16 bond. So guys, we made alpha 16 bond from alpha 14 to alpha 16 transport has been done. Okay, so that's how the alpha 16 bond is made, and guys, glycogen is ready for its job. Glycogen is made. Simple. How simple it is, right? So if you make something like this, if you understand like this, it's very easy. तो पहले हमारे पास रेजिडुअल ग्लाइकोजन था, फिर हमने खाना खाया, ब्रेकफास्ट किया, फिर हमने यूडीपी ग्लूकोज से ऐड किया, फिर ब्रांचिंग एंजाइम से ब्रांच बनाया, माय ग्लाइकोजन इज रेडी, कीप ऑन रिपीटिंग द स्टेप्स till we get a highly branched glycogen with 60,000 glucose residues, है ना, that is called as a beta particle. तो कई बार हम उसको like microscopically when we see, that is called as a beta particle and it has 60,000 glucose residues around. Okay, that's your glycogen. Okay, so guys, glycogen is now made. Fine. Now, in the glycogen synthetic pathway, I also told you the regulation point, most important point, that is, how it is being activated. Insulin and G6P, that you must remember. I told you guys about the muscles also. Muscles also store the glycogen and they need the GLUT4 for that. So that is why in the diabetic patient, in the diabetes mellitus, when the insulin activity is low or there is insulin resistance, muscles may not be able to form glycogen properly, right? Similarly, the liver may also not be able to form glycogen properly, right? May be possible. Okay, now guys, there is a disorder which is called as the glycogen storage disease. So there are around 7 glycogen storage disorders that I will discuss, right? With each topic, I'm going to say, right now I'll discuss one most important, that is called as type 4. So type 4. क्योंकि हमने अभी सिर्फ synthesis पढ़ा है, right? Not the degradation. Guys, that is Anderson's disease. Okay. So that is called as the Anderson's disease, right? In the Anderson's disease, there is deficiency of enzyme that is called as branching enzyme. Okay, देखो जस्ट टू रिमेम्बर, एंडरसन में ब्रांचिंग डिफिशिएंट होता है, कोरीज में डी ब्रांचिंग डिफिशिएंट होता है. सो दैट इज लाइक एबीसीडी ऑफ द ग्लाइकोजन स्टोरेज डिसऑर्डर्स. एंडरसन ब्रांचिंग, कोरीज डी ब्रांचिंग, राइट. ओके, सो दैट इज लाइक आवर एंजाइम्स व्हिच आर डेफिशिएंट. अब देखो इस केस में क्या होता है, व्हेनेवर देयर इज अ ब्रांचिंग एंजाइम डेफिशिएंट तो क्या होगा. तो अगर ब्रांचिंग एंजाइम डेफिशिएंट है तो ग्लाइकोजन तो बनेगा, बट विथ less branches. Okay, glycogen with less branches. Fine. So bracket में we can write like amylopectin. Okay, so like the amylopectin. So glycogen with less branches or more linear glycogen is formed. तो इस टाइप का ग्लाइकोजन बनेगा, राइट, लेस द ब्रांचेस। मतलब देखो नॉर्मली ब्रांच कहाँ पे बन रहा था, एवरी एट्थ पे सपोज। अब जो ब्रांचिंग बनेगा दैट विल बी लेट से, जैसे मान लो पहले ग्लाइकोजन था मेरे पास ऐसे, सपोज लाइक दिस। ओके, सॉरी, लाइक दिस। Fine, we had a frequent branching initially, but now the new glycogen which is formed, let's say it has a branching like this only. So very few branches are there. So this is, I can say, more linear and less insoluble, right? So it is less insoluble, basically. Okay. So linear glycogen is formed. So guys, this linear glycogen looks like amylopectin. Guys, this is a very important point which will help us in the difficult scenario questions where they can say that, you know, the glycogen is being accumulated, which looks like amylopectin. Okay. So guys, this is less soluble. So less soluble glycogen is now being formed. Okay. So when it is less soluble, this will precipitate. Okay. Let's say we are talking right now about the liver cell. So this will precipitate in the liver cell, right? So when it precipitates, there will be, you know, guys, this will may act as a particulate material, right? So this may act as antigen. Matlab, this can be one of the theory. Antigen, you know, guys, what is antigen? Antigen is a, something which can induce the immunity, which can induce the activation of immune cells. You all know that. So this may act as antigen, right? Basically. And against this antibodies will be made by our B cells and B cells, right? तो एंटीबॉडीज क्या करेंगी, इस एंटीजन को अटैक करेगी, और वो एंटीजन हमारा लीवर के सेल के अंदर है, दैट इज आर ग्लाइकोजन, राइट? ओके, सो दिस विल कॉज इन्फ्लेमेटरी प्रोसेस। फाइन, सो यहाँ पे क्या होगा, एक इन्फ्लेमेटरी प्रोसेस स्टार्ट हो जाएगा। फाइन, इन्फ्लेमेटरी प्रोसेस विल स्टार्ट which leads to liver damage. Fine, liver damage and ultimately failure of the liver. So liver will be failed. So guys, this patient का initially क्या हो सकता है कि, you know, this child may present with jaundice, hepatomegaly, that means enlarged liver हो सकता है, ठीक है। शुगर लेवल कम हो सकता है बिकॉज लीवर इज नॉट वर्किंग, सो हाइपोग्लाइसीमिया हो सकता है। एंड गाइस, अगर हम और टेस्ट करेंगे तो लीवर का जो टेस्ट होता है, आप एलएफटी पढ़ोगे अलग से भी, तो उसमें हम मोस्टली वी विल बी टॉकिंग अबाउट एएलटी एंड एएसटी, तो उनका जो लेवल होगा बहुत हाई होगा। नॉर्मली जैसे 30 35 30 35 होना चाहिए, इट मे बी लाइक 3000 तक पहुंच सकता है, या मे बी 300 तक पहुंच सकता है इनिशियली। सो एएलटी एंड एएसटी राइजिंग सेज दैट लीवर हैज बीन डैमेज्ड। तो ये सब एक्स्ट्रा इंफॉर्मेशन हो सकते हैं इन आर एमसीक्यू, इन आर क्वेश्चन, आई मीन टू से, right? So liver damage and failure, guys. So guys, remember, this is the only disease where the liver failure and damage is very common, very common. Okay, means और disease में हो सकता है, but it's not so early. Actually, here in this case, there will be death by 4 years of age. Fine, so baby will die by the age of 4 years. So guys, this is called as Anderson's disease. The only treatment for this disease, which is not a common disease, is a rare disease, right? So the only treatment for this disease will be liver transplant. Okay, so just patient needs a organ donor for the liver transplant. You got my point, guys? So this is our, so let's take just one question that you can easily answer, similar to this only, similar to that what we have discussed. Okay, it will be like this only, same question that I have discussed. So a liver biopsy is done on a child with the hepatomegaly and the fasting hypoglycemia. Hepatocyte shows accumulation of glycogen granules with the amylopectin-like structure. Okay, guys, this is the one more term that you can add to your notes: polyglucosan bodies. These जो precipitate बन गया है, I told you ना, because insoluble है, तो glycogen has become precipitated. तो वो जो precipitate है, वो उसको हम बोलते हैं polyglucosan bodies. Bodies मतलब होता है something which is insoluble. जैसे पहले कीटोन बॉडीज बोलते थे हम, है ना, अब एक्चुअली कीटोन तो सॉल्युबल होती है वाटर में, तो नाउअडेज बॉडीज वर्ड हैज बीन ड्रॉप्ड. हम सिर्फ कीटोन्स बोलते हैं, कीटोन बॉडीज नहीं बोलते. Right. So polyglucosan bodies is the other term for this uh, glycogen precipitate. So guys, what is the most likely genetic defect? So I told you it's a case of Anderson's disease, and option B is the correct answer. Right? Option B, that is our D branching enzyme. I mean to say this is our branching enzyme. So ये हमारा branching enzyme है. Okay. So it's easy, right? Nothing difficult here. It's easy one. Okay. Right, guys. So that's what we have discussed about the glycogen synthesis.